A 35-year-old female presents after being stabbed with an ice pick during a robbery. Her examination is normal except for a 0.5 cm hemostatic wound to the right flank at the level of the second lumbar vertebrae. Bedside ultrasonography reveals no free intra-abdominal fluid. Her urinalysis does not contain blood. What is the most appropriate next step? A. Obtain a renal ultrasound scan. B. Obtain an 4 contrast-enhanced CT of the abdomen and pelvis, with additional images of the renal collecting system 10 minutes after contrast injection. C. Perform a retrograde cystogram. D. Perform a retrograde urethrogram. E. Treat the patient's pain, counsel her on appropriate wound care, and discharge her home with outpatient urology follow-up in 1 week. Answer is B. Obtain an intravenous contrast-enhanced CT of the abdomen and pelvis, with additional images of the renal collecting system 10 minutes after contrast injection. In cases of penetrating renal trauma, the presence or absence of hematuria is not a reliable predictor of upper urinary tract injury. The location of the penetrating injury in relation to the urinary tract is the most important determining factor in deciding the need for radiographic investigation. Therefore, the absence of hematuria in a patient with a gunshot or stab wound in proximity to the urinary tract does not eliminate the need for intravenous contrast-enhanced CT as the initial diagnostic examination. Significant injuries to the kidney and ureter may occur in penetrating trauma without hematuria. Additional images obtained at 10 minutes after contrast injection are indicated to evaluate for delayed contrast extravasation and to maximize the sensitivity of the study. A 25-year-old male presents after an unfortunate incident resulting in a scrotal injury and a left testicle that was traumatically amputated. The patient brings the amputated testicle with him in a towel. All of the following would be indicated except A. Analgesics for the patient. B. Emergent urological consultation. C. Place the amputated testicle directly on ice. D. Prepare the patient for possible operative exploration by the surgeon. E. Wrap the amputated testicle in saline-soaked gauze. Answer is C. Place the amputated testicle directly on ice. Amputations of either the testicles or penis require immediate surgical evaluation. In the interim, the amputated part should be wrapped in saline-soaked gauze, and then placed in a sealed bag, which can then be placed in another bag that is filled with ice. The amputated part should never be placed directly on ice. Direct pressure is usually adequate to achieve hemostasis. A 30-year-old female presents after blunt abdominal trauma after a motor vehicle collision, and an ultrasound demonstrates free fluid. You suspect a bladder rupture. A true statement about this entity includes which of the following? A. A bladder contusion may be successfully managed with Foley catheterization drainage. B. Extraperitoneal bladder injuries are typically managed with surgical intervention. C. It is unimportant to distinguish an intraperitoneal from an extraperitoneal bladder rupture. D. Most patients with an intraperitoneal bladder rupture will resolve with Foley catheter drainage. E. Most penetrating bladder injuries will resolve with Foley catheter drainage. Answer is A. A bladder contusion may be successfully managed with Foley catheterization drainage. The distinction between extraperitoneal bladder rupture and intraperitoneal bladder rupture is important because the management differs. Contusions and extraperitoneal injuries due to blunt trauma are typically managed conservatively with Foley catheterization, unless they are complicated by other intra-abdominal injuries, bladder neck injuries, bone fragments in the bladder wall, or if open reduction is performed on an associated pelvic fracture. In contrast, given the extremely low likelihood of intraperitoneal bladder rupture and penetrating injuries healing with conservative therapy, almost all patients with these types of injuries are taken to the operating room for exploration and repair. Without surgery, there is an extremely high likelihood of complications, which include infections and fistula formation.